differences between leptospirosis and amebiasis. Here's a well-explained version for exam-level preparation. Hanner 1. Definition. Leptospirosis, an acute zoonotic infectious disease caused by pathogenic Leptospira species, characterized by fever, jaundice, renal involvement, meningitis, and hemorrhage. Amebiasis, a parasitic protozoal infection caused by Entamoeba histolytica, leading to intestinal dysentery and extraintestinal manifestations like liver abscess. 2. Causative agent leptospirosis, caused by Leptospira interrogans, a thin, spiral-shaped motile spirochete bacterium. Amebiasis, caused by Entamoeba histolytica, an amoeboid protozoan parasite that exists in cyst and trophozoite forms. 3. Reservoir leptospirosis. Reservoirs include wild and domestic animals, especially rats, dogs, cattle, and pigs, which excrete leptospires in their urine. Amebiasis. The main reservoir is infected humans who pass cysts in feces, contaminating food and water sources. 4. Mode of transmission. Leptospirosis. Infection occurs through contact with water, soil, or food contaminated with urine of infected animals. Occupational exposure. Farmers, sewage workers, veterinarians, and floodwater are common sources. Amebiasis. Transmission occurs by ingestion of mature cysts of E. histolytica through contaminated food, water, or dirty hands. It is purely fecal-oral in nature. 5. Portal of entry. Leptospirosis enters through skin cuts, abrasions, intact mucous membranes of the eyes, nose, or mouth, and occasionally through inhalation of aerosols. Amebiasis. Entry is via ingestion of cysts, which pass through the stomach and exist in the small intestine, releasing trophozoites that invade the colon. 6. Primary system affected. Leptospirosis, a systemic infection that affects multiple organs, kidneys, liver, lungs, central nervous system, and eyes. Amebiasis primarily affects the gastrointestinal tract, especially the large intestine, colon, and rectum, but may also spread to the liver. 7. Incubation period. Leptospirosis, 2 to 30 days, average 7 to 14 days. Amebiasis, 2 to 4 weeks, sometimes longer, depending on host immunity and parasite load. 8. Clinical features. Leptospirosis, phase 1, septicemic, sudden high fever, chills, severe headache, muscle pain, especially calf tenderness, conjunctival suffusion, nausea. Phase 2, immune, jaundice, renal failure, aseptic meningitis, hemorrhages, pulmonary symptoms. Amebiasis, intestinal, abdominal cramps, diarrhea alternating with constipation, dysentery with blood and mucus and stool, tenesmus, weight loss. Chronic, recurrent dysentery with malnutrition. 9. Complications, leptospirosis, Weil's disease, severe leptospirosis with jaundice, acute kidney injury, myocarditis, meningitis, pulmonary hemorrhage, and multi-organ failure. Amebiasis, amoebic liver abscess, peritonitis, intestinal perforation, toxic megacolon, pleuropulmonary abscess, and rarely cerebral amebiasis. 10. Extraintestinal involvement. Leptospirosis commonly involves kidneys, nephritis, renal failure, liver, hepatitis, jaundice, lungs, hemorrhage, CNS, meningitis. Amebiasis most commonly causes liver abscess, occasionally lung or brain abscess due to spread of trophozoites through the portal circulation. 11. Diagnosis. Leptospirosis, blood and urine culture for leptospires. Serological tests like microscopic agglutination test, ELISA for IgM antibodies, PCR for detection of leptospiral DNA. Amebiasis, stool microscopy to detect trophozoites or cysts, antigen detection tests and PCR. Imaging, ultrasound CT scan for amoebic liver abscess. Top 12 treatment, leptospirosis. Early treatment with antibiotics such as penicillin, doxycycline, ceftriaxone, or azithromycin. Supportive therapy for renal or hepatic failure may be required. Amebiasis, metronidazole or tinidazole for tissue infection, followed by luminal amebicides, iodoquinol, paromomycin, to eradicate cysts and prevent relapse. Number 13. Prevention, leptospirosis, rodent control, protective clothing for high-risk workers, avoiding swimming or wading in contaminated water, and chemoprophylaxis with doxycycline in endemic areas. Amebiasis, safe drinking water, proper sanitation, hand washing, washing vegetables, fruits, and food hygiene. Ahana 14. Geographical distribution. Leptospirosis, more common in tropical, subtropical, and flood-prone areas, frequently seen in agricultural and poor sanitation settings. Amebiasis, common in developing countries with poor sanitation, overcrowding, and lack of clean water supply, highly prevalent in Asia, Africa, and Latin America. 15. Mortality. Leptospirosis, severe cases, Weil's disease, may lead to high mortality due to jaundice, renal failure, hemorrhage, and respiratory distress. Amebiasis, death usually results from complications of liver abscess, rupture into peritoneum, pleura, or brain, or severe dysentery leading to shock. Thank you. Have a nice day.